In this presentation, we will explore the business value of IT, and specifically, we will estimate the relative value of VISTA for the Department of Veterans Administration. The use of health information technology has been prompted as having tremendous promise in improving the efficiency, cost effectiveness, quality, and safety of medical care delivery. The promise of IT systems may be substantial, however, healthcare leaders report problems with implementation and failure of installed systems. Therefore, valuing IT investments prior to implementation is of great importance and value in order to establish if it is worth the investment. We need a proper method of evaluation, which we'll be exploring later on. At first, a quick highlight of the Department of Veterans Affairs. It was established as an independent agency on July 21, 1930, to serve America's veterans and their families to ensure that they receive medical care benefits, social support, and lasting memorials. The services and benefits are provided through a nationwide network of 153 hospitals, 895 outpatient clinics, 135 nursing homes, 47 residential rehabilitation treatment programs, 209 readjustment counseling centers, 57 veterans benefits regional offices, and 125 national cemeteries. This shows how big the operation of the VA is, and the Department of Veterans Affairs was one of the pioneers in implementing successfully an electronic health record system called VISTA on such a large population of patients. The VISTA system, it is the VA's award-winning health information technology system that provides VA patients with an integrated inpatient and outpatient electronic health record. It also provides the administrative tools to deliver veterans the best quality medical care. The number of potential patients that could be affected by VISTA is 23.8 million of veterans and 37 million of dependents. The VISTA is used by the VA facilities and most medical centers. For the purposes of our analysis, we have decided to use data pertaining to IT use, IT investment, and productivity as our variables in order to establish whether there exists a causational relationship between IT investment and productivity. These data shown on the table were obtained from the Department of Veterans Affairs, and it was obtained on August 20th, 2010 from the department pursuant to the Freedom of Information Act. The method we used to evaluate the business value of IT is called the activity-based costing, which is ABC method, and it starts with the total organizational costs. Total organization costs includes many obvious costs like personnel costs, but it also includes many subtle other costs such as cost of employees going on vacation, cost of improved productivity, and impact of quality on market share. This method shows causation between the variables and not only a correlation in the mechanism of the cause. Hence, it is more objective because it accounts for all the costs. The first step we propose for the analysis of return of IT investment projects starts with gathering data at least for three time periods. This could be 3 years, 3 quarters, or 3 months. Of course, we can gather data on a longer sequence of time periods. However, the minimum we need is 3. The data collected in our case is money spent on IT, use of IT, and productivity. The second step in the analysis is to see if there is a relationship between IT investment and productivity, between investment in IT and IT use, and between IT use and productivity. This can be done easily by plotting productivity against investment, for example, and see if as investment increases, so does the productivity. As we can see the result in this graph, there is a relationship, a correlation between IT investment and productivity. As we can see here, the more we invest, the productivity increases, the x-axis is the productivity and the y-axis is the investment. In this table we show that there is a correlation as well between IT use and IT investment, and between productivity and IT investments, and between IT use and productivity. As you see, R is positive in all of them. However, the relationship between IT investment, IT use and productivity is only 0.57. Although it exists, it is not significant. As we can see here, the two possible causational scenarios are: investment leads to more IT use, which could increase productivity. In this relationship, the correlation was found to be 0.46. And the second scenario is that productivity leads to investment, which leads to more IT use. The correlation here was found to be minus 0.12, which is a closer value to 0, while the other correlation is farther from there. Therefore, we cannot say that investments in IT would necessarily lead to productivity in the case of the Vista utilized at the VA. Finally, we should mention the study limitations. The first one is the ability of data should be from at least 3 periods. The second one, the relationship between the variables must exist. If these two conditions are not met, then we cannot conduct our analysis using the ABC method.